Hello and welcome. I'm Dr. Emily Carter. Tonight, I want to talk about something that's on the minds of many men, but it's a topic that often gets buried under a layer of silence, or, worse, gets targeted by late-night commercials promising miracle cures in a bottle. We're going to talk about male performance. This is a sensitive subject, and for good reason. It's deeply personal and tied to a man's sense of self and vitality. When you notice changes in this area, whether it's a decrease in desire, stamina, or reliability, it can be disheartening. It can cause worry and even strain relationships. Many men I see in my urology practice assume it's an inevitable downhill slide that comes with age. They come in with a sense of resignation, asking, "I guess this is just how it is now, right?" And while it's true that our bodies change as we move through our 50s, 60s, 70s, and beyond, a sharp decline is not a foregone conclusion. What I want to share with you tonight is that you have far more influence over this aspect of your health than you might believe. NTHE answer doesn't lie in a magic pill. It lies in the simple, powerful habits you practice every single day, or in this case, every single night. And tonight, we're going to build a simple 4-step nighttime routine. These aren't gimmicks. Each step is backed by solid science and is designed to support the very systems your body relies on for healthy male performance: your hormones, your circulation, and your nervous system. This is about creating a foundation for health that allows your body to function at its best. NSO. Let's begin. NNHE, critical link between night and performance. Gradient. Before we get into the how, it's crucial to understand the why. Why is your nighttime routine so incredibly important for male performance? It comes down to two key processes that happen while you sleep: hormone production and circulatory repair. First, let's talk about hormones. Your body's most significant surge of testosterone production doesn't happen during the day when you're active. It happens at night, specifically during the deep stages of sleep. Think of your body as having a night shift dedicated to manufacturing this vital hormone. If your sleep is short, fragmented, or of poor quality, that night shift gets cut short. The production line is shut down prematurely, and you wake up with lower levels of the very hormone that governs desire and function. 1 or 2 bad nights won't make a huge difference. But when poor sleep becomes a chronic pattern over months or years, the cumulative effect on your testosterone levels can be significant. Second, and just as important, is your circulatory system. Healthy performance is, at its core, a matter of blood flow. It requires your blood vessels to be flexible, open, and responsive. During the day, your system is under constant pressure. But at night, during deep sleep, your blood pressure naturally lowers. This gives your heart and your entire vascular system, from the largest arteries to the tiniest capillaries, a chance to rest and repair. This nightly repair process helps reduce inflammation and maintain the health of the delicate lining of your blood vessels, called the endothelium. A healthy endothelium is essential for producing a molecule called nitric oxide, which is the key signal that allows blood vessels to relax and open, enabling strong and reliable blood flow when you need it. The NSO. When we talk about a nighttime routine, we're not just talking about getting to bed on time. We are talking about creating the optimal conditions for your body to run its essential nightly maintenance programs. Get this right, and you are directly supporting the 2 pillars of male performance, NN. Step 1, the power down hour. And our first step is perhaps the most important. It's creating a power down hour for the 60 minutes before you intend to be asleep. In our modern world, we live under constant stimulation. We finish our day, and what do? We sit in front of the television watching the nightly news, which is often stressful. Or we scroll through our phones, with their bright blue light-emitting screens just inches from our faces. This is a disaster for sleep. NTHE blue light from screens. Your TV, your tablet, your phone sends a powerful signal to your brain that it is still daytime. This directly suppresses your body's production of melatonin, the hormone that tells your brain it's time to sleep. Without sufficient melatonin, your mind stays wired and alert, even when your body is tired. Furthermore, the content we consume, the news, stressful emails, intense dramas, activates our sympathetic nervous system. This is our fight or flight response. It raises our heart rate and blood pressure and floods our body with stress hormones like cortisol. You cannot enter deep, restorative sleep when your body is in a state of high alert. NSO, the power down hour, is a non-negotiable buffer zone. Here's what it looks like. N1 hour before bed, all screens go off. No exceptions. Instead, you intentionally switch to calming activities. This could be reading a physical book or a magazine, not on a backlit device. It could be listening to calming music or a podcast. Many of my patients find great success with journaling, taking just 5 minutes to write down any worries or tasks for the next day, effectively emptying their mind onto the page so they don't have to carry those thoughts to bed. NTHE goal here is simple. You are signaling to your brain and body that the day is over. You are shifting from the fight or flight system to the rest and digest system. This simple act of powering down your environment allows your melatonin levels to rise naturally and your nervous system to calm down, paving the way for deep restorative sleep. In step 2, the circulation-boosting snackin'. Our second step involves a specific, science-backed nighttime snack. Now, I'm generally not a fan of eating a large meal before bed, as it can interfere with sleep, but a small, strategic snack can be incredibly beneficial. We're going to focus on 2 key nutrients, L-arginine and magnesium. And first, let's talk about L-arginine. This is an amino acid that serves as the direct precursor to nitric oxide in your body. As we discussed, nitric oxide is the master molecule that helps your blood vessels relax and expand. By ensuring your body has a good supply of L-arginine, you are providing the raw material it needs to maintain circulatory health. One of the best food sources of L-arginine is a small handful of walnuts or pumpkin seeds. Just a small handful is all you need. They are not only rich in this amino acid, but also provide healthy fats that are good for your heart. Next, we pair this with a nutrient that helps the body relax. Magnesium, and I call magnesium the body's relaxation mineral. It helps calm the nervous system and can reduce the levels of the stress hormone cortisol. It also plays a role in regulating blood pressure and, as we know, is crucial for deep sleep. And a fantastic, gentle source of magnesium is a simple cup of chamomile tea. Chamomile naturally contains compounds that have a mild, calming effect on the brain, and it's a wonderful, warm, and hydrating way to end your day. NSO, your circulation-boosting snack to be enjoyed during your power-down hour, is simple: a small handful of walnuts and a warm cup of chamomile tea. You are doing 2 things at once: providing the building blocks for circulatory repair and actively calming your nervous system to prepare for sleep. It's a simple, powerful combination: positive, encouraging music. And step 3, the gentle stretch for blood flow. And step 3 is about gentle movement. I'm not talking about a full workout, which would be counterproductive before bed. I'm talking about a 5-minute gentle stretching routine focused on the hips and lower back. NWHY, this area specifically. Many of us spend a large portion of our day sitting at a desk, in a car, or on the couch. This leads to incredibly tight hip flexor muscles and a stiff lower back. This chronic tightness doesn't just cause aches and pains, it can also subtly restrict blood flow to the entire pelvic region. NTHE, major arteries that supply blood to the lower half of your body, all pass through this area. When the surrounding muscles are chronically tense, it's like having a gentle clamp on the system. NBY, performing a few simple stretches before bed, you can release this tension and encourage healthy circulation. This isn't just about immediate blood flow, it's about restoring the natural flexibility and openness of this critical region over time. Here are 2 very simple stretches you can do. NTHE, kneeling hip flexor stretch. Kneel on a soft surface. Bring one foot forward so your knee is at a 90-degree angle. Then, gently press your hips forward until you feel a light stretch in the front of the hip of your back leg. Hold for 30 seconds. Don't bounce or push into pain. Then switch sides. NTHE, child's pose. Kneel on the floor, sit back on your heels, and then gently fold forward, resting your forehead on the floor and extending your arms in front of you. This is a wonderful stretch for releasing tension in the lower back. Breathe deeply and hold for 60 seconds. That's it. Just a few minutes of gentle, mindful movement can release the tension built up during the day and open up the channels for healthy blood flow while you sleep. Step 4, the cool and dark sleep sanctuary. Our final step is about optimizing your environment. You can do everything else right, but if your bedroom is not conducive to sleep, your body will struggle. You need to turn your bedroom into a sleep sanctuary. This involves two key elements: coolness and darkness. First, coolness. Your body's core temperature needs to drop slightly to initiate and maintain deep sleep. A bedroom that is too warm can actively prevent this from happening, leading to restless, fragmented sleep. The ideal temperature for sleep is generally considered to be between 60 and 67 degrees Fahrenheit, or about 15 to 19 degrees Celsius. This may feel cool at first, but once you're under the covers, it's the optimal temperature for deep rest. Second, and just as critical, is darkness. Your brain is exquisitely sensitive to light, even through your eyelids. Any light in your bedroom, from a street lamp outside, a digital alarm clock, or a television standby light, can filter through and disrupt melatonin production, pulling you out of the deeper stages of sleep. Your goal should be to make your room as close to pitch black as possible. This is where blackout curtains can be one of the best investments you ever make for your health. Use a piece of black electrical tape to cover any small LED lights on electronics in your room. If you can't make the room completely dark, a comfortable sleep mask is an excellent and inexpensive alternative. Creating a cool, dark sleep sanctuary tells your brain in the most primal way possible that it is safe and it is time for deep, uninterrupted rest. This is where the magic of hormonal regulation and circulatory repair truly happens. Warm, concluding music begins to fade in softly, and a routine for lasting vitality in NSO. Let's quickly recap our simple 4-step nighttime routine. Step 1, the power down hour. 1 hour before bed, turn off all screens and engage in a calming activity. Step 2, the circulation boosting snack. Enjoy a small handful of walnuts and a warm cup of chamomile tea. Step 3, the gentle stretch. Take 5 minutes to release tension in your hips and lower back. And step 4, the cool and dark sanctuary. Optimize your bedroom for deep, uninterrupted sleep. As you can see, none of these steps are complicated or expensive. But when you combine them, you create a powerful synergy. You are actively calming your nervous system, providing key nutrients for circulation, releasing physical tension, and setting the stage for the deep sleep your body needs to produce testosterone and repair your vascular system. This is not a quick fix. This is a long-term strategy. It's about respecting your body's natural rhythms and giving it the support it needs to function well for years to come. It's about investing in your health in a way that fosters independence, confidence, and a lasting sense of vitality. Thank you for taking this time for yourself tonight. I hope you'll give this routine a try. Be patient with yourself, be consistent, and you may be surprised at the difference it can make. Take care and sleep well.